Good afternoon or good morning, depending on where you are. Thanks so much for joining us. My name is Rochelle Davis, and I'm President and CEO of Healthy Schools Campaign, and we are going to get started in just a minute. In the meantime, please introduce yourself in the chat box and share your school district mascot. Okay, I think we're going to get started. Good afternoon again, everyone, and thanks for joining us. As I said, my name is Rochelle Davis, and I'm President and CEO of Healthy Schools Campaign. Healthy Schools Campaign advocates for policies and practices that support students in creating healthy learning environments. Our work is based on the simple and common sense notion that healthy students are better learners. We also recognize that there are many challenges that schools face in providing students with the supports that they need, particularly those that are serving low opportunity communities. We seek to change policies and systems so that all students will have the opportunity to go to a school that supports their health and wellness. Over the years, we have worked on many issues, including healthy school food, opportunities for physical education and activity, healthy school facilities, including green schoolyards, and providing students with access to coordinated and comprehensive physical and mental health services. Today's briefing is focusing on the opportunity to expand Medicaid-funded school health services in Illinois. Before we get started, a few housekeeping items. Presentations are being recorded for those who are not able to attend. Participants are muted to ensure audio quality, and you can submit questions using the question and answer feature, but during the official question and answer period, you'll also be able to raise your hand. As I just mentioned, today we are going to focus on the opportunity for Illinois schools to expand Medicaid-funded school health services. This new opportunity is the result of a 2014 change that allowed school districts to receive reimbursement for medically necessary services from allowable providers. Prior to that, school districts were only able to receive reimbursements for services that were part of a student's IEP. Most states, including Illinois, needed to make changes to their state Medicaid plans in order for schools to have this opportunity for expanded reimbursement. We are pleased to report that on September 30th, 2021, the state Medicaid agency made that request to the federal Medicaid program. The state is awaiting their approval. So today, we are going to provide a status update of the Illinois State Plan Amendment and how it will affect school districts and Medicaid billing. We're going to highlight the important benefits of expanding school health services, and we're going to answer questions and offer resources and opportunities to support. Joining me today is Rosa Ramirez-Richter, Healthy Schools Campaign Chicago Policy and Program Director, who will review the changes that are being proposed in Illinois. Then Laura Frankel-Distinctor, our MESH Learning Collaborative Director, will share with you some additional resources and the opportunity for you to join a learning collaborative to support this transition. Alex Mays, our Senior National Program Director, is also on the call today to help answer your questions. This map shows where states are in their effort to expand Medicaid-funded school health services. I know that a number of people on the call today are not from Illinois. Please take a look at the map, and if your state has made the changes and you want more information, go to the Healthy Students Promising Future website. If your state has not made the change and you're interested in working on this in your state, please let us know. We are here to help you. The benefits of expanding Medicaid-funded school health services are many. Our students today are facing mental and behavioral health challenges at unprecedented levels. I do not need to rattle off a bunch of statistics because you are seeing this in your schools and communities. We also know that many people, including children, have delayed health care as a result of the pandemic. Schools need to be prepared to address the consequences of this delay in health care. While there are a lot of new federal resources available to support student health, particularly mental and behavioral health, it is a one-time investment. Expanding Medicaid-funded health services provides an ongoing and sustainable source of funding for schools. So as you can see from the slide, by expanding Medicaid-funded school health services, you can have increased sustainable revenue or reimbursement for schools. There'll be an expansion of allowable health services and service providers. You will be able to increase the number of students served and service providers, and you'll improve access to care for Medicaid enrolled children. Hopefully there'll be reductions in overall healthcare costs and improved academic outcomes. Here are a few examples of how expanding has supported increased access in states who have made this change. Louisiana, which was the first state to expanded in 2015 for school nursing services only. The data showed a 35% increase in Medicaid revenue, leading Louisiana to submit a second state plan amendment to expand the program to include all eligible providers and services. Colorado had conducted a pilot study to better understand the financial impact of expanding its school Medicaid program and determined that expanding the program and adding additional types of providers, including school psychologists, would result in $12 million in new federal Medicaid funds. The SPA was approved in 2020. In Michigan, they estimated an increase in $14 million from adding school psychologists, a provider group that had previously not able to bill Medicaid. Michigan has also added many other health providers and expanded billing to include all medically necessary services. That SPA was approved in 2019. And North Carolina's expansion allows districts to access reimbursement for a wide range of services. They saw a 35% increase year over year in Medicaid reimbursements with no financial outlay for the state Medicaid agency. Their SPA was approved in 2019. As I mentioned, Illinois is moving forward with expanding Medicaid-funded school health services. As part of this, they've also made changes to the billing methodology. The change to the billing methodology is required. But today we are focusing on the opportunity to expand Medicaid-funded school health services. We will touch on the billing change and direct you to additional resources. In addition, we will invite your school districts to participate in a learning collaborative to support you in this transition. Now it is my pleasure to introduce Rosa Ramirez-Richter, the Director of Chicago Programs and Policy, to share what is happening in Illinois.
Thank you, Rochelle. And again, thank you to all who are on the call today and making time to learn about this. So again, we're going to focus in on this exciting opportunity in Illinois to pursue expanding access to school health services. So the state has made a lot of progress. But first, I just kind of wanted to level set the conversation. Once more, I know we have new people on today's call, but for the last 30 years, Medicaid has played a key role in funding the delivery of school health services. So all states have school Medicaid programs and allow school districts to bill for certain services delivered to Medicaid enrolled students. But historically, school districts were only able to bill Medicaid for health services included in the student's individualized education programs, or also known as the IEPs. And so again, this might include services such as speech therapy, physical therapy, or certain school nursing services and more. But we know that school health providers are delivering many more services than those that are just included in the student's IEPs. For example, in Illinois, about 14% of Medicaid enrolled students have IEPs, which means that school districts have not been able to bill Medicaid for services delivered to the remaining 86% of Medicaid enrolled students. So a lot of money being left on the table. And in 2014, the federal agency that oversees Medicaid, which is the Centers for Medicare and Medicaid Services, changed this longstanding policy and clarified that states can indeed expand their school Medicaid programs to allow school districts to bill for all Medicaid eligible services to all Medicaid enrolled students. It's a little counterintuitive, but this change is known as the free care policy reversal. We won't get into the nuances of that, but it just really, to take home, it presents a tremendous opportunity for states to expand access to school health services and increase sustainable federal funding to support school health. Next slide. So again, just to give you another visual perspective of this, 17 states have leveraged this opportunity and 5 states are in the process. That's the lighter shade of green. And we're hoping we can include Illinois as to be in that darker green color, hopefully soon. Next slide. So what does this look like in Illinois? So Healthy Schools Campaign, along with many other partners in Illinois, we have long been advocating for Illinois to take advantage of this tremendous opportunity and move forward with that, with this policy change. And so on September 30th, we were successful, and the Illinois Department of Healthcare and Family Services, which is the state agency that oversees Medicaid in Illinois, they submitted its Medicaid state plan amendment. So that's the SPA acronym we have been using so far, to expand the state school Medicaid program. So again, the change would allow school districts to bill Medicaid for all medically necessary services included in an individual health plan, a doctor's order, a 504 plan, or any other plan of care that meets criteria set by HFS. So what this means is that any service that would be Medicaid eligible for a child receiving care in the community will be eligible if the child receives the same service in a school-based setting. And again, this is just underscoring the crucial role that schools play in delivering healthcare services to communities. And this will also enable school districts to draw on Medicaid funding to support this work. So once the SPA amendment is approved, the change will be retroactive to July 1st of 2021, which means schools will be able to bill for services already delivered to Medicaid enrolled students. And right now, the Illinois State Plan Amendment, we're hoping it will be approved in the spring. So any day now, we're holding our breath here on our end. Next slide. So just to give you a little bit of color of what are the current services that are Medicaid eligible under Illinois school Medicaid program. Here are a few on the screen here. And these same services will be Medicaid eligible under the expanded program once the SPA is approved. So in addition, the state is adding orientation and mobility services and applied behavioral analysis services through the amendment. So the ones with the little star, those are the new services that will be added on once it's approved. Next slide. And the same school health providers that are currently Medicaid eligible under the Illinois program will still be Medicaid eligible under the expanded program. And in fact, the state is adding a number of key provider types as Medicaid eligible. So for the first time, they're going to be having licensed marriage and family therapists available, licensed clinical professional counselors and clinical psychologists, orientation and mobility specialists, and also board certified behavioral analysts in Medicaid, and a few others. And just a quick note on that, school districts cannot bill for services delivered to the general student population or by these additional provider types until that SPA is approved. But once it is, then they can retroactively bill for these services up to July 1st of last year. Next slide. And so I think this is everyone's favorite topic, cost settlement. So in addition to expanding the state's school Medicaid program, the Illinois SPA proposes to modify the state's reimbursement methodology to a cost settlement reimbursement methodology. And so what that means is it's a process that allows districts to receive the full cost of providing services to the students they serve. And cost settlement therefore helps ensure Medicaid reimbursement is consistent with the actual costs being incurred in providing those services. And so the new methodology will apply to both the existing school Medicaid program, so that's services included in a student's IEPs or IFSPs, and the new expanded program. And once approved, the change will also be retroactive to July 1st. I also wanted to share that the state of Illinois is working with a group, the PCG Consulting, to support the school Medicaid program, including how to implement the state's new cost settlement methodology. We know it's a lot, so PCG has done 2 rounds of training on cost settlement and will continue providing support and training in school districts to transition on how to implement and use this new methodology. And we'll also send out a presentation they did recently about this cost settlement methodology to our Illinois Learning Collaborative, if you will find it useful. And as a follow-up to this webinar, we'll make sure to also send a link to that presentation as well as the contact information for the consulting group. All right, so that was a lot of information. We wanted to pause here for any questions, and feel free to drop them in the chat and we'll take them one by one. Thank you.
Thank you, Rosa, for that overview of the change. There are a number of questions that have come up and they're kind of still coming in. One of them, will the slides be shared? So we are absolutely going to share these slides. And as Rosa mentioned, we will also share the presentation that was made about a month ago that dives much more deeply into the whole cost settlement question. And it appears that another set of information, as Peter just put in the chat, another set of informational centers were just sent out to districts' contacts for May 9th through 11th. And hopefully we'll get that information also and share that with you. And there was also a question to try to understand if there is a list of which nursing services are billable. I'm pleased to introduce Alex Mays, our National Program Director. And Alex, can you help our audience understand what nursing services are billable or how they find that out?
Thanks, Rochelle. And we can follow up with more information about this on the specifics of the nursing services, but the way we understand it as the state plan amendment is being written is that it would be really any Medicaid eligible, nursing service that would be eligible within a community-based setting would be eligible within the school-based setting delivered by a qualified provider. And so I think really thinking through, those services that your school nurses are providing, whether they're around chronic disease management services or whatnot. I think the key piece, though, is that there's still, certainly requirements around ensuring that those services are medically necessary and that key Medicaid requirements are met, and that those documentation processes are in place to support that those services are Medicaid eligible. But we can certainly find any specifics on the list of nursing services and circle back with those.
And Alex, you alluded to this question of documentation and documenting medical necessity. One of the questions, so there've been a couple of questions about that, and trying to understand if there is billing under a doctor's order, how long must the order be kept for? And maybe you can just do a little bit of a bigger overview of the documentation that might be that is going to be required under the this expansion.
Sure. And so I do not know the specific answer to how long a doctor's order has to be kept on file. I know we have Peter Gillis from PCG Consulting is on, I just saw. And so Peter, if you know the answer to that question, please feel free to weigh in via the chat. But I would just say, you know, in terms of documentation, so there are a number of ways in which the state will be providing support to ensure that school districts have the information that they need to appropriately document these services. And so in the past, that has primarily served, the Individualized Education Program, or IEP, has primarily served as that form of documentation. But moving forward, it could be services that are included in a student's 504 plan. It could be you know, services that are under a physician's order or a prescription. And so there's a number of ways in which those documentation requirements could be met. And I think we'll see more information from the state on some of those specifics once the state plan amendment is approved.
And then Alex, the next question is, why is it still important for districts to continue to bill for Medicaid services if we move to a cost settlement? And I think the person who asked the question is maybe asking more specifically about how the cost reimbursement process will go, or possibly the value. If you want to provide some clarification to this question, please feel free to raise your hand. Alex, otherwise, if you can just speak to the question of billing versus cost settlement.
Sure. So with the state's move to cost settlement, as Rosa shared, that's really designed to capture the cost of running a school health services program. And there's a methodology behind that where providers will receive a random moment in time survey and document the service that they were providing at any given moment in time. And then in turn, that'll be used to calculate the percent of Medicaid eligible time essentially that providers in a given school district are spending, and that's used to calculate the reimbursement. But I think what the question is probably referring to is that in addition, the district still moves forward with submitting their claims through the standard, essentially the fee-for-service process. And that's really key because that is actually an expectation from Centers for Medicare and Medicaid Services, and is key for a number of reasons. But a big one is documentation and ensuring that there's appropriate mechanisms in place to support that the services are actually being delivered to students, and it plays a key role in just really, tracking who is receiving those services, what services are being delivered, and backing up the reimbursement that is coming through that cost settlement methodology. So it plays a really key role, in terms of being a system of essentially checks and balances to make sure that a district is continuing to deliver those services and that documentation is in place.
So Alex, your favorite topic, another question about documentation. And this question is again, very specifically wanting to understand I believe the structure of the documentation, and the question was, will these expanded services need to be written into an IEP as in the past?
So no. So the expanded survey, I think that's a key question and point of clarification. In order to be Medicaid eligible, these services do not need to be written into an IEP. So the services that have been written into an IEP that are Medicaid eligible, that process is staying the same. Districts will still be able to bill for those IEP services. That moves forward. But in addition to that, we're now layering on all those additional services, again, that might have been included in a student's 504 plan, a behavioral health intervention plan, different plans of care, or are delivered, through a standing physician's order, prescription, or what have you. Now districts are able to bill for those additional services outside of an IEP. So essentially what the state's Medicaid plan amendment is doing is lifting that requirement that in order for districts to be able to bill for these services, they have to be included in IEPs. And it's really expanding that. And as was shared by Rochelle, in a really great way that enables districts to draw down additional funding for the full scope of services that they're delivering, and really recognizes the key role that districts are playing in terms of sites of healthcare service delivery.
And we are working on some guidance to help school districts understand this process, and that's a major topic that we're working on in the Current Learning Collaborative, and hope to have some additional resources to share. Alex, a request for some clarification about the kinds of services that are being added outside of that orientation and mobility. And Stephanie, maybe you can go back to the one of the previous slides that had the services.
So again, right, so as Stephanie is going back, so I think, so in terms of services that are added, so now districts will be able to claim for orientation and mobility services, as well as applied behavioral analysis services. And that is true if those services are included in a student's individualized education program, as well as delivered to the general education population. I think the key in kind of thinking about when we talk about the additional services that are going to be Medicaid eligible under this change, it is, again, it's those services that are being delivered outside of a student's individualized education program. And I think where that's particularly impactful is when we think about behavioral health services and various chronic disease management services, and services that we usually don't see included in a student's individualized education program. And so that's really where the opportunity is. So it's less, those are services that have been eligible if included in a student's IEP, but we might not necessarily see those included. So it's really kind of thinking about the full scope of services that providers in your district are delivering to Medicaid enrolled students. And this presents an opportunity, when they are eligible services and delivered by Medicaid eligible providers, to draw down funding for that. And then in addition, for all students, IEP and general student population, once the SPA is approved, retroactive to July 1, they'll be able to bill for those orientation and mobility and ABA services.
So there are some additional questions about the role of PCG, who handles our IEP students with medical eligibility, and will they be handling the new billing services? So I'm not sure if the question is about the fact that the individual school districts hires PCG, and will they be expanding, but PCG is the provider that, or is the organization that the state Medicaid agency has hired to manage the program on behalf of the state. And they will be dealing with both the IEP students and with the expanded eligibility. Alex, is there anything to add on that? Do I have that right?
Correct. So districts will still be able to continue using vendors that they have been using. There's no need to change that if they're, happy with that relationship they have. And just as Rochelle said, PCG is the vendor that will be running things on the state's end.
And then there is a question about school district expectations. So under free care, is it an expectation that all districts should expect to receive more dollars? Or is it possible that they could receive less under free care? I think are a couple of things to unpack in that question.
So I think with regards to free care, we are talking about enabling districts to bill for additional services on top of what they're already billing for IEP services. I think the question mark a lot of districts have is with the state's move to a cost settlement methodology, how that could potentially impact overall reimbursement as a whole in states that have made the move to this methodology. And there's over 20 states that utilize it. So Illinois is joining many states. States have seen a net increase in terms of Medicaid revenue coming into the state after making the switch to cost settlement. And so I think that is the expectation for Illinois, that there will be a net gain for the state through making this change to cost settlement. I think in terms of what that looks like in districts, it remains to be seen. But I think our hope would be that in the event that there might be a slight dip in some cases from cost settlement claiming for the IEP services, that would be offset by the increased revenue coming in through billing for those expanded services. So I think we certainly see, you're taking the existing IEP program that your districts have been billing for and then just adding to that and adding on top of that this host of additional Medicaid eligible services that are delivered to the general student population. And so we would hope that would certainly result in an increase. I think the question mark is around cost settlement, but we certainly expect and hope that the majority of districts would see an increase from the move to that change. It just, it's gonna be a little bit district by district.
And Alex, a few more questions about documentation. So for those services not requiring a doctor's note, can a licensed practitioner of the healing arts, i.e. psychologist, sign the plan? If so, will they need to have an MPI number in order to be reimbursed?
So yes, so the state plan is very clear that a licensed practitioner of healing arts is able to sign off on the plan of care in order to determine that those services would be Medicaid eligible. I am not sure on the NPI question, and I should know that, but I'm sorry, I don't. But it is, yeah, the state is very clear that the licensed practitioner of healing arts are able to sign off on those services to ensure that they're Medicaid eligible. Okay, and there's Peter. Thank you, Peter, for saving the day. District staff are not currently required to get an individual NPI number. That's what I thought, but didn't want to mislead people.
And then we do have a question about this issue of crisis and emergency services that do not already have an established plan of care. And is there a mechanism to bill such as a specific crisis code or documentation that can be used to substantiate medical necessity in these specific cases?
So that's a great question. Yeah, and I'm not certain on that piece. I think my understanding is that is under development and that state is working to determine how they are going to handle that piece. Oh, and I just see Peter typed in the same thing. Yeah, so it's under development. It's an issue that comes up in every state we work with to expand their school-based Medicaid program of how to handle, we call them unplanned services or pre-plan of care services. And it particularly comes up for the crisis intervention services. And so states have handled it in different ways. We completely understand that's a huge need, and it's a reality that it's what school districts spend a lot of their time doing. And so it's very much on the state's radar, and it's something that they're working on. So we will wait to see how they determine how to handle that specific issue.
Okay. And I'm going to kind of switch to some other types of questions that have come up. So there is this question of when will the spot actually be signed? And we don't know, and we want to know. There is from the time that the state Medicaid agency submits the spot to the federal Medicaid office, they have 90 days to respond. But the 90 days comes with moments where that is frozen, when questions are being asked and answered, and we do not know where we're at in the 90 days. But from our other experience, we would expect that this should happen before the end of the school year. But it is retroactive. All of these changes are retroactive to July 1st of last year. So that is definite.
And I would just add, you know, as we shared on the map, there's a number of states that have state plan amendments pending right now. It's completely out of our control, you know, in terms of the timing. As Rochelle said, you know, we hope it's soon, but there's a lot going on right now on this front with Centers for Medicare and Medicaid Services. But I will say, you know, we have worked with a number of states that have gone through this process, and Centers for Medicare and Medicaid Services has been highly supportive of states moving forward with this change, which is great. And so it's very much that this is what Illinois is going through is very much the normal process. You know, they're getting questions from CMS, they're answering those questions. There's no reason to be, you know, concerned about the timing. It's just really in the hands of CMS.
So there was also a question about kind of the blending and braiding of funding sources to cover services. And specifically, if a school district is getting reimbursed from Medicaid, and they use grants to cover some of the same services.
Sorry, can you say, so, right, so can they use, so braiding and blending funding?
With grant funding.
So yes, so it gets a little tricky. So certainly we recognize that Medicaid plays a critical role in supporting school districts, in hiring school health providers, in supporting the delivery of health services, but it's likely not to cover the full cost of those services. And so it's critical that districts are braiding and blending funding streams to support the delivery of those services. And those could be combining the Medicaid funding and coming in with other state and local funds, with local philanthropy, what have you. So it is key. We know many districts are doing really thoughtful work in terms of combining those funding streams. This gets a little bit into the weeds, but is an important thing to note that because Medicaid is a federal state partnership, you can't double dip on the federal dollars. So you have to be really districts need to be really careful with their accounting, that if they are funding a provider's position with federal dollars or with partial federal dollars, they need to be careful about how they're claiming for that time. If a provider was 100% federally funded, a district would not be able to bill Medicaid for that provider's time, because that would be double dipping on the federal dollars. So that's something I think is particularly relevant right now as districts have COVID relief dollars through the federal government. And I know a lot of districts are doing great work around hiring school health providers with those federal COVID relief dollars. And so they just need to be very careful kind of around that documentation and accounting for those services. But it's something I know districts are very familiar with. They're also funding these positions with, you know, federal Title I dollars, with Individuals with Disabilities and Education Act dollars. So they're used to that accounting, and you know, if they're covering part of the provider's time with those federal dollars, they're able to bill for some of that provider's time to Medicaid. But the short answer is yes, you know, braiding and blending funding plays a really key role in terms of supporting these providers in the delivery of these services.
So we have time right now for one more question before we go on with our presentation. So we won't be able to get to all the questions. I will ask Alex to take a look at the questions we haven't gotten to if we're not able to get to them later in the program. But our final question for you, Alex, is do you expect that this change will lead to many more districts and schools being able to provide individualized mental health supports for students in schools?
That is our hope. So I want to say yes. You know, I think in the short run, I think for districts to really think about this as bringing in Medicaid revenue for services that you're already delivering and really strengthening the program. But certainly our hope is that this will result in additional providers across the board, but certainly school-based mental health providers that can lead to additional services. And anecdotally, we've seen that in a number of states that have expanded. Michigan is a state that expanded a couple years ago, and they made this change. They also coupled the change with a significant investment from the state in school mental health providers for general education population, but it combined with that state funding, with making this change statewide, their behavioral health providers increased from around 1,700 to 3,000 behavioral health providers statewide. So you would assume that then those additional 1,300 behavioral health providers are certainly, providing individualized behavioral health services to students across the state. So it's very much our hope that that will be the case in Illinois once this change is underway.
Well, thank you, Alex, for all of the feedback that you have provided for everyone's questions. And thank you, Rosa, for that overview presentation. We're going to now turn to Laura, who will talk about some of the additional resources and opportunities that are available to help you through this transition.
Thank you. So our Medicaid expansion for school health services learning collaborative was designed to help school districts really take advantage of this exciting opportunity. And we are wrapping up our first year of the project. So we're recruiting 10 new districts to participate starting next fall, and wanted to share some information about the project for those that might be interested in participating. Next slide. The objectives of the collaborative are for participants to be able to develop a comprehensive plan for securing Medicaid reimbursement and expanding their school health services, identify and implement effective strategies to bill Medicaid for eligible school health services, and leverage partnerships and funding from Medicaid and other sources to expand health services for students. And just a quick note that by health services, we do mean to include physical, mental, and behavioral health. Next slide. So the model we're using for this project really has a strong focus on peer learning. So we provide opportunities for participants to share strategies and ideas and work together to find solutions to common challenges. It's based on a team approach, which I'll talk about in a second. And we also have a systems focus. So we're really going to guide you to look at your whole billing and health services infrastructure and all of those processes. Next slide. We ask our participating districts to form a team, and those teams should include staff from the areas of school health services, behavioral health, and or wellness, from special education, from finance, or you can include your billing vendor, and from district administration. Aside from the administrator, who should be at the district level, the other team members can be at the school level, and you will need to identify those team members in order to submit your application. If for some reason you can't identify someone from those roles, maybe you have an open position or something like that, please reach out to us to discuss an appropriate substitute or workaround. And we have found that this team has been really important with our first cohort. We find that each of these members of the team typically knows sort of a piece of the Medicaid billing. And by bringing everyone together, your team can really get a better understanding of the full picture of what's happening and come up with ways to improve your processes. You can also engage a parent or a student partner, representatives from other agencies that are providing health services in your schools, and any other staff that you think would be important to include on your team. So you can identify that as part of the application or after you're accepted into the project. Next slide. We will provide supports to your team in a number of different ways. We're planning to hold 3 to 4 meetings per year, as well as 3 to 4 peer-to-peer calls to facilitate sharing among our districts. And we have an amazing group of districts in our first cohort, so you will have the opportunity to learn from them as well. We provide resources, tools, and a monthly newsletter during the school year. And finally, we will provide individual assistance and check-in calls to help you with questions and challenges. Another nice aspect of the project is that we gather feedback from our districts and we share that with HFS and with ISB. So it's really a nice opportunity to help influence and improve school-based Medicaid in Illinois for all school districts. Next slide. For our meetings, we provide a mix of capacity building or skills type training on topics like identifying needs and assets and developing an action plan for implementing changes. And then of course, we also provide training and information on Medicaid and health services topics, such as those shown on the slide. Next slide. If you are interested in this project, but Medicaid expansion maybe seems a little bit overwhelming, do not fear. We encourage our participants to break this down into steps, and we will provide support for you based on wherever you're starting from. So if you're currently billing Medicaid and you would like help improving and expanding that, we can work with you. Next slide. In order to apply for the collaborative, you do need to be an Illinois public school district and have approval from your district leadership and have the members of your district team identified. And you should feel like you're ready to actively leverage the training and support provided by the collaborative to expand school health services. I will note we've gotten a lot of interest from special education cooperatives. And if you are a special ed co-op and you are interested in this project, what we encourage you to do is to partner with one of your districts and apply together, so you would be part of their team. We have that structure in our current cohort and it is working well, we think. And that gives you the opportunity as a co-op to access all of the information and share with your other districts, as well as having a district who can focus on that Medicaid expansion piece beyond IEP students as well. Next slide. We do ask districts to commit to this project for 2 years and expect that folks will attend our trainings and group calls. In terms of the requirements, your team will need to develop and implement an action plan. You'll need to meet as a team on a regular basis, and we will ask you to complete a brief annual progress report. So our estimate is that it's around 3 to 5 hours per month to participate in project activities. That includes preparing for and participating in trainings and calls, meeting with your team, and developing and implementing your action plan. Hopefully that this project helps facilitate what you are already doing as part of your job by giving you some strategies and processes around expanding Medicaid billing and school health services. And we definitely aim to help save you some time by providing resources and technical assistance to help you with challenges that are coming up. But it is a time commitment, so you should feel like you have the capacity for that. Next slide. Before I wrap up, I just wanted to acknowledge the support and expert guidance that we received from our advisory committee members. This group is really an excellent resource to us and to our participants to help answer questions and address challenges as they come up. Next slide. So we hope that you will consider applying. We've had a great first year and we're excited to welcome some more school districts into our MESH family. If you do have any follow-up questions, please don't hesitate to contact me. So my email address is here. I've also included the link to the call for applications, and we'll drop that into the chat as well. Next slide. We also wanted to just share a few resources that Healthy Schools Campaign has developed on this topic. So we have a frequently asked questions page. There's a link to some more information about our MESH collaborative, and we have 2 reports that provide some really helpful information on school Medicaid opportunities. Next slide. And finally, we wanted to share the link to the HFS school-based health services website and the contact info for PCG. So you can contact PCG with any specific questions you have about Medicaid billing. And we wanted to let you know that HFS and ISB are working on a detailed frequently asked questions document about the changes to Illinois school Medicaid program. And we will be sharing that out when it becomes available. ISB is also creating a section on their school health website where they will be posting that FAQs document and other resources on school Medicaid. So that will be available soon as well. And I'm going to turn it back to Rochelle for final questions.
Thank you, Laura. So there was a question about the special education cooperative being able to apply, but I think that you have covered that. There was also an inquiry about what districts are already participating, and I don't know if I certainly can't list them off the top of my head, but we can certainly share that. I can say that we have the largest school district in Illinois, and we have some participating along with some very small ones. Most of them are geographically located, within a couple-hour drive of Chicago, but we do have one in the East St. Louis area. So a range of different school districts. Are there any other, I guess there was also a question, someone was having a hard time getting the percentage of Medicaid eligible students. They wanted to know, how do they get that? Because I created my MEDI account.
Yeah, so for if the question is in regards to filling in that question on the application, if you don't have that information available to you at this point, that's okay. You can leave it blank or put a question mark, or if you have kind of a general guess of what you think it might be, you can fill that in. We know some folks don't sort of have the infrastructure to set up to easily access that statistic. So it's okay if you don't have that information. It is helpful for us to know if you feel like you have a large Medicaid population or a smaller Medicaid population in your district. So if you have a sense of that, you can share that information with us, but we will not exclude you because you don't have that data.
And then there was a question about whether this will be available to the early childhood education programs, such as Head Start and Early Head Start programs. And it was unclear to me if that question was about MESH or about the Medicaid program in general. But Laura, if you could kind of comment on their participation in the Learning Collaborative?
That's a great question. We haven't talked about that. So I think whoever asked that, if that was in regards to the collaborative, if you could just send me an email. So I have your contact info, and we can think about that and get back to you with an answer pretty quickly.
And then there was a general question about to explain the purpose of the Learning Collaborative. So I don't know if you want to, Stephanie, go back to the slide about some of the goals, and Laura, if you wanted to expand on that.
Yeah, so it's really focused on helping you improve the billing that you're already doing to maximize reimbursement for your IEP students, and then from there, looking at expanding to the general education population and helping you set up systems and processes for billing for those services that you're providing to the general education population. And then bigger picture purpose, it's not just about collecting more money for your district, although that's nice. But we would like to see that money funneled back into really expanding, improving, increasing services that you are offering, health services, mental health services, behavioral health services to your students. So thinking through what kind of gaps you have in your existing services and what would be the best way to use that additional reimbursement that you're getting to really provide better care and better supports for the students in your district.
And I do want to add that another really important role, more collaboratively, is that the questions and issues that come up are shared with, and we engage with both HFS and ISB about them, because they're both in the process of setting up support systems for school districts, and the kinds of issues that emerge are really important for them to understand as they develop their support systems. So by participating, you'll not only help your own school district implement this program, but you will also help inform how the state moves forward in supporting all school districts. So at this point, we have 4 minutes left. So I'm gonna say thank you to our presenters. I'm going to say thank you to Peter for adding your insights on many of these questions. And thank you to all of you who are participating. We really hope to hear more from you. We hope that you will join us, and those that are not in Illinois, we welcome the opportunity to support efforts in your states. So thank you very much and have a great day.